According to the Office of Disease Prevention and Health Promotion, the prevention and management of osteoporosis is among the leading health topics and areas of public health needed for this year. My guests today are Beth Battaglino. She's an RN and the CEO of Healthy Women. And she's joined by Dr. Orlando Ortiz, a radiologist, chair the Department of Radiology of the North Bronx Healthcare Network. So today we're going to talk about the risk factors, prevention, and management of osteoporosis. Welcome.
Thank you.
Thank you so much.
Thank you both for joining me. Beth, so we hear a lot about osteoporosis. Exactly what is it?
So osteoporosis is also known as the silent disease. Osteoporosis actually means porous bones. It's the thinning and weakening of the bone, which makes the bone very fragile and more susceptible for fracture or break. And it can happen over a period of a number of years, and it affects women four times more than it does men. It can affect men and women, but it affects women 4 times more than men, unfortunately.
So who's at risk and how does it impact women's health?
So women are impacted more, and actually age too. So if we look at the United States, we have, it's an estimated 5.3 million people over the age of 50 are living with osteoporosis. Again, it affects women at a higher rate than men, so it really makes it a women's health disease. And as far as prevention, you can prevent osteoporosis, but if you have osteoporosis, there are a lot of treatment options. So some of the preventions could be, making sure that you have a diet high in calcium, making sure that you're doing weight-bearing exercises such as running, walking, swimming, lifting weights, and we can't forget about the core, right? Because the core helps us stabilize and balance. So it's really important that your audience is taking care of themselves. And if you are diagnosed with osteoporosis, then it's a time to make that call. If you're diagnosed with osteoporosis, there are some treatment options, and Dr. Ortiz can talk a little bit more about vertebral compression and what you need to know.
How do bones become porous?
What happens with it's a combination of dietary intake, which commences actually in your youth and adolescence, and if you're not eating well during that time period, which is not uncommon, you don't put enough calcium in your bone bank, if you will. And then it also relates to activity, sun exposure, and also some hereditary factors as well, because there is a hereditary component to osteoporosis. So all these factors combined lead to this silent process which impacts people in later decades of life.
So Dr. Ortiz, what's the difference between, say, normal back pain and abnormal back pain, and when should you speak with your doctor if you're having a back issue?
Well, certainly normal back pain is the usual aches and pains that we get after exercising, after excessive activity, excessive gardening, picking up something heavy. This can be typical, short-lived, and may respond to Tylenol or some other basic anti-inflammatory agent that's over the counter. But if the pain persists and it had occurred at an unusual moment, so for example, some trivial event such as sneezing or coughing or bending over to tie your shoe, and you're in the age range, and if you've been diagnosed with osteoporosis previously, then you need to suspect that something is going on, and you may likely need to come and go and see your healthcare provider to get that taken care of.
I've also heard a lot about vertebral compression fractures. What are they?
They are actually the most common type of fractures in people with osteoporosis, affecting about 750,000 people annually. A vertebral compression fracture is a broken bone, a bone block in the spine. And when this occurs, it can lead to severe pain, deformity, and height loss. Fortunately, there are treatments available for this, including non-surgical management, which includes medical management such as bed rest, bracing, physiotherapy, and analgesics. But there are surgical procedures such as a balloon kyphoplasty, which is a minimally invasive surgery that can be used to reduce these fractures, stabilize the broken bone, and provide significant pain relief.
So Beth, it's really important then for women to speak with their healthcare providers about their symptoms. And what about a bone density test? Where does that come in?
So bone density test is usually recommended for women age 50, you get your baseline. And so it is really important for women to understand that that's part of their annual wellness test visit. So make sure that you're keeping your appointments. Women, put yourself on the list. For many women, we always put our kids, our husbands, even the dog comes before us. So remember to put yourself on the list. We know you're never going to be number one, but we'll settle for number 3. Make your appointment. If you're experiencing back pain that's chronic, that's lasting more than 48 hours, it's important to have that conversation with your healthcare provider. Get the proper diagnosis, and then discuss your treatment options. And for more information, women can visit healthywomen.org.
All right. So I hear there's some good news, and that now there are some minimally invasive options to help treat the symptoms.
Well, you're actually treating the fracture. That's how you improve the symptoms. It's a structural problem when the bone breaks, and it needs a structural solution. And this is a very clever way of providing that by putting in a special device inside the bone that lifts up the bone and tries to restore its normal anatomy and configuration within the spine. And by doing this, it creates a cavity inside the bone when you inflate this orthopedic balloon inside the bone. And it creates a cavity, and this cavity is filled with an acrylic bone cement that stabilizes the bone, and it's an implant that's there for life. It works great, and when the fracture is stable, you don't feel pain.
And what's the recovery time for that procedure?
Once you have the procedure, which is often done on an outpatient basis, whether it's in a hospital setting or at an outpatient care facility, you usually are discharged several hours after you recover. You return home, you take it easy for about a day. You resume your activities gradually, so that the recovery period is actually fairly brief and very reasonable.
And what preventative measures are there that women can take in order to avoid back pain and spinal fractures?
Well, the first thing is to take care of the osteoporosis. Make sure you have adequate dietary intakes of calcium and vitamin D. The second key point here is exercise in moderation to keep a strong body, to have better balance, and to also build stronger bones.
Well, you guys have shared a lot of information with us, and I love that there's some good news then, and thanks to medical advances in recent years that, patients who now have treatment options available that have been shown in clinical studies to provide pain relief and increase the quality of their life. So check out that website. Once more, Beth, it is
healthywomen.org.
All right, wonderful. Thank you both for joining me.